Yeah, and I think we're especially interested in why you use them, how you use them, and um, what drives you to use the nosodes more often.
Absolutely. I think they are very effective. In fact, to frankly tell you, I cannot imagine my life without nosodes, sarcodes, and bowel nosodes because it's such a big part of my practice. See, I'm a very simple homeopath based in Mumbai, and I see roughly about 35 to 40 patients every day here in Mumbai, um, and of very complex type of pathologies, which means that the patient might come with a tuberculosis or a palliative oncology where they have some chemotherapy taken, or a very complicated arthritis, or a patient of stroke. Sometimes I even go to the hospital to see the patients where patient is paralyzed. So in these cases, I do realize that one has to be very, very flexible about using homeopathic remedies in a very flexible way, especially the use of nosodes, sarcodes, bowel nosodes, even fungi remedies, even imponderablia. Sometimes these remedies need to be used in between for a certain phase of time to really help the healing process further. And this is something that many classical homeopaths in the last hundreds of years have spoken about, including Clark, including Grimmer, including Master Burnett. It's not something that I'm doing new that I'm going to talk about. It's something that our classical homeopaths, our masters, our ancestors have been doing. Unfortunately, we have forgotten to use it so much. The current generation is more interested in using very rare, unproved remedies. But my calling is to bring in classical homeopathy back into fashion, and that's what I'm trying to do in my limited capacity. So that's the idea, more or less. So we will have a. I think I will try to present some cases where I learned a lot, where I use nosodes and sarcodes, and that's what my focus would be. You tell me when you're ready. We'll start I will start talking a little bit about the lecture, or we have started the recording already.
Yes, we already started recording, so
I didn't see. Sorry, I just went in a conversation, so I didn't realize. Sorry for that. Yeah.
no problem. We will cut what we like and
Yeah, you can. That is very good. Like I'm giving you, because I'm not a very seminar person. I am a kind of person who likes to converse. I don't talk for many people. Just very few people I can share very nicely. Like I'm talking to you. Like just today, I saw a couple of very interesting cases. That I learned. There was this case of a woman who is in the hospital whose whole skin is burnt. She was playing crackers and the crackers bursted and whole body burns. It's called as a third degree burns. Now, I've taken her case and everything. One of her main themes is she talks about is that she wants to connect to people more. She misses being with people because she's in the hospital for past few months. So her main feeling is feeling isolated, feeling alone. And then she suddenly says, I feel like a celebrity. I feel I'm very different, that people are wanting to come and meet me because, I've not met them for many years and I want to meet them. I want to meet them. And then she says about this whole skin, which is burnt and is very dry and it's not healing. Can you give a homeopathic remedy to accentuate the process? Now, if you open the repertory, and I'm just wondering if I can actually open the repertory here. Um, Let me open um, one of the repertories, which I can here. Let's see. Okay, yeah, there we go. So a lot of my work is based on repertory. It's something which is that I cannot live without, because homeopathic literature is so vast that we cannot not use the repertory, because you will need the repertory at some point in in homeopathic practice. So in the repertory, in the burns, one of the interesting remedies, imponderablia. It's the remedy X-ray. It's a remedy prepared from X-ray. That's what I gave, because X-ray has this And remedies belonging to imponderabilia have this pattern of being very different, being very special. Remedies like prepared from moon rays or sun rays, they have this theme of being very special. And it's X-ray is the most important remedy for chronic burns. When there is acute burns, we think about cantharis. Of course, we know causticum, we know, but this is very typical of the remedy X-ray. Another, I remember very interesting, just today, I've just written down what came to my mind out of nowhere. Very nice case of, very, very bad case of diabetes, very high blood sugar not coming under control. And I'm treating the gentleman for his diabetes, for his necrosis, for so many of his problems. And when I studied the case, I found that even after taking anti-diabetics, his blood sugar is not coming under control. And he has some very typical symptoms, the symptoms of wanting to do everything very fast-paced. This is an important indication for Sarcode. The Sarcodes are basically hormone remedies, remedies prepared from healthy tissue. For example, remedies prepared from pancreas. There is a Sarcode called as pancreatinum. Remedies prepared from insulin enzyme, insulinum. Remedy prepared from peptic enzyme called as pepsinum. Remedy prepared from the pituitary gland called as pituitary gland. There are 3 remedies from pituitary gland. Pituitary gland, pituitary anterior, pituitary posterior. All of them have different indications. So this particular gentleman, very, very fast paced, want to do things very, 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 very fast. And his blood sugar not coming under control for a very long time. This is, along with this, a lot of burning in the hands and feet, cannot tolerate hunger, extreme appetite. All these are, and we will discuss about this, all these are patterns of Sarcode remedies. These people who require Sarcode are people who are very, very, very fast-paced, who want to do things very, very fast. These are also people who are having a lot of hormonal disorders, whether symptoms like polycystic ovarian disease, whether symptoms of thyroid, whether symptoms of diabetes, and so on. So that's the remedy I gave. I gave him insulinum 30-200-1 m. This is like an intercurrent dosage that I gave in between. That is going to accentuate his healing process. So many Sarcodes like this. Today, another case I remember that I gave, very interesting remedy, was a child where there is a massive developmental delay. The child is not developing at all. That, he's a 6-year-old child, but his mind is not developing. His body is not developing. His speech is not coming. He's not able to walk properly. So there is what we call in clinical medicine as a global delay. Many such cases, as many remedies you give, there will be no change. You will need help of a Sarcode. Sarcodes are remedies, as I told you, which are prepared from healthy tissues. The 3 or 4 important Sarcodes which we have to differentiate from are as follows. The main Sarcode I often use in a very big developmental delay is the remedy pituitary gland. It's a remedy prepared from the pituitary gland. You can read about the literature from Clark Dictionary of Practical Materia Medica. This is a remedy I use a lot for developmental delay when the child's mind and the body is not developed, where the sexuality, even there is cryptocorticism, the testes are not developed. The body, there is not even no sexual development, no physical development, nothing. In many such cases, I'm using pituitary gland. On the other hand, some children, there is a developmental delay, but they eat a lot of sweets, constantly eating sweet. And they're putting on a lot of weight. Many you see in Europe, in India, in America, just burger, just pizza, just cake, very often they require the remedy insulinum. So insulinum is a Sarcode, again, very important for such kind of children. You can read about this from a book, very rare book. It is called as SC Ghost, Rare and Forgotten Sarcode. This is a very interesting book. Hopefully, when I come to the Netherlands, hopefully you will remind me and I will get you some books, very rare books, which from our literature as a gift to all of you. This is an important remedy, insulinum. The other very important remedy in children who have developmental delay but cannot concentrate, cannot focus, is a remedy called as DNA. deoxyribonucleic acid. Very important. You can read about this remedy from OA Julian Materia Medica. There is a Materia Medica called as OA Julian. So these children who require DNA, they are total developmental delay, but they can't concentrate. They can't focus. If you tell them to see something, they will do like this. So they are like this, DNA. On the other hand, another children, developmental delay, but very hyperactive. They are running about. They just can't hold themselves. And especially they are restless at night and they have a lot of craving for sugar. And you're thinking about tuberculinum. They require another Sarcode. It's called as RNA. Okay. Again, you can read about this from Murphy Materia Medica or even from Julian's Materia Medica. Another type of children you will see very interesting, where along with all of this, now what you study also is that not just their blood sugar, but they are becoming more hyperactive. They are becoming more destructive. And their growth is developed. Their height is stunted. It's a 10-year-old child, but it looks like a 4-year-old child. You understand? Like a stunted growth. Body is not developing. So the mother is coming and telling you, doctor, everything is okay, but the body is not developing. And he's very restless. He's very hyperactive. He has a lot of craving for sweets. Yeah? And in the mother's history during pregnancy, the mother had a lot of history of autoimmune disorders, a lot of thyroid disorders. Many of these children require thyroid in them very nicely. So this is just one differential diagnosis about children's developmental delay and how homeopathic remedies can help. And of course, hopefully, when I come to Netherlands, we are going to discuss about all these different remedies through cases, through clinical experiences. In fact, me with the help of my colleagues have prepared the first repertory of Sarcodes and Nosodes. Okay, I will share it to all the participants who register for our seminar as our gift. So you will have to remind me, and all people who register for our seminar, whether it's online or in person, we will be giving this document as our gift to all our friends. So this is one of the things that you asked me to talk about the Sarcodes. But also I want to tell you, Nosodes is very important. And there have been in the past certain homeopaths, for example, Swan. I'm a little old school homeopath, although I'm open to newer ideas. Huh? I have been very lucky. I don't know where my I have been very lucky that I got an opportunity in my life to study from many different homeopaths in my younger days. I'm still young though, but yeah, fun and yeah. So I learned from many different homeopaths. I used to go to every street or every city or any place to learn. That's where I learned from people like Dr. Sankaran, people like Dr. Vijaykar, people like Dr. Sarkar, people like, I even went to Switzerland to learn from Heiner Fry. So I was open enough to learn from everywhere and anywhere there is an opportunity. And that's what I try to do in my life. And now I'm trying to integrate a lot of these approaches together and choose the approach depending on the type of case. So I was telling you about the nosodes. So there have been homeopaths in the past who have been only prescribing nosodes also. So it's such an integral part of practice. I told you Swan, Allen, these people were master of nosodes. What we think, tuberculinum, medorinum, sorinum, syphilinum, we know 5-6 nosodes, but remember, there are 27 types of tuberculinum, 27 types. There is, of course, we know about the tuberculinum cox, or the one that Kent uses, tuberculinum bovinum, but there is basilinum burnet, there is tuberculinum aviare, there is tuberculinum residium, there is tuberculinum dennis, there is cox lymph, and every of this tuberculinum nosode, 27 nosodes. And maybe someone can later on type this remedies as a subtitle later, just to know what I'm talking about. Or I will share with you a small page of all the tuberculinums that you can share it with our friends. That every of this tuberculinum is different and has different indication. For example, one of the child, his problem is nocturnal enuresis. He passes urine frequently. And for nocturnal enuresis, the best tubercular nosode is Basilinum testicum. That's another type of basilinum. You can read about it from Clark Dictionary Practical Materia Medica. See the third and fourth line in the characteristic page. Yeah. So there are 27 types of tuberculinum. So imagine how much we have to still study and evolve. And not just this, there are so many more rare nosodes, remedies like staphylococcinum. I mean, I'm going to present an entire capsule of about 20 cases back to back of staphylococcinum and how I've used it and how homeopathy has helped so many of our patients. I often use staphylococcinum as an intercurrent remedy. And there is not only a physical picture, but there is also a mental picture. Staphylococcinum as a nosode is a very important even for burnouts. So they have a feeling that too much, too much, too much, and there is a burnout, and there is a feeling of trapped feeling. There is a feeling of victimized feeling. This has come in the newer provings of staphylococcinum.
Very nice.
So has a lot of things. I just wanted to give you a little idea and invite all our friends to our, first of all, to our webinar in May, and then of course to our seminar in November. So I hope that all of us can meet, all of us can learn, all of us can learn from each other's cases, practice, and cultures. And as you say, as we know, art is long, life is short, isn't it?
Amazing. Thank you.
Sorry for my fast-paced differential diagnosis, but I wanted to share this quickly so that you can later on edit some part of it and then choose what to put, because I didn't know what you want to put.
Sure. This is great.
Yes.
And we're looking forward to meet you at the webinar and also in Holland here. I'm sure you have a lot of knowledge to share with us and a lot of experience, and it would be lovely if you could introduce us to the Sarcodes more, to learn to recognize these patterns.
We will do that.
Yes.
Would be great. Yeah.
Thank you. Thank you.
Thank you. Thank you, everyone.
Yes.
Namaste.
See you later.
See you later. See you later to all my friends who are sitting with you also. Okay.
Okay.
Will do.
Bye.
We'll keep in touch. Bye.
Yes. We'll keep in touch. Bye.
Bye.